Hey everybody, my name is Paolo and I'm going to start shooting a set of videos regarding testosterone replacement therapy because that is something that I am going on or that I'm having treatment for, and I'm actually about to go through a testosterone crash from not getting treatment. So I thought I would just document the whole process and everything that's happening, and just try and provide a bit more helpful information to those of you out there that are or are going to go through a similar sort of experience. So let me start off by telling you my situation. I went on testosterone replacement therapy about 4 years ago. My testosterone levels were low, probably the levels of about an 80-year-old man. And my doctor prescribed it to me, and I've been getting treatment ever since. And I will do videos about what levels you should be on in order to get prescription and whether you need it or not, but that's a topic for another video. So I've been getting treatment for the last 4 years, and then recently I moved to the UK. And I went to the NHS to continue getting my treatment, which is an injection I get once every 3 months. And the NHS and the GPs that I visited decided that they weren't going to treat me. They said that my levels weren't low enough, and in order for them to actually treat me, they want to retest me, and they want to check my levels and see what the actual problem is and where the cause of this low testosterone is. So I decided, fuck that. I'm not going to go through testosterone crash because I had scenarios or situations before where I hadn't got my injection in time and I'd started to crash, and it was hell. So I thought, there's no ways I'm going through a proper crash and going through all of that, and I just continued getting my injection from my physician in Holland. But then after about a year or two, I decided that it's becoming a hassle, and it's probably going to be the best thing to go through this whole testing process to actually see where the problem lies. Because yes, my testosterone levels were low, and that for some doctors is good enough to get a prescription and get the injection once every 3 months, but that doesn't tell you why the levels are low. That just tells you that the levels are low. So I decided to take the jump and go through the whole testing process and go cold turkey, do a testosterone crash, not get my injections and my treatment, and see where the problem actually lies. So I stopped today is January the 10th, 2015, and I had my last injection in July of 2014. And the reason for that is they want to wean me off the testosterone shots because it stays in your system for quite long. Then they put me on the testosterone gel just so that the crash or the come down of the injections that I was having wasn't too severe. And I've been on the testosterone gel until the end of December 2014. So basically at the 1st of January, I stopped the testosterone gel and now have been completely cold turkey. And for those of you that don't know what this means, if you have low testosterone, you might think it's just physical benefits or side effects that you see, but it's not. There is a huge mental element to it as well. And testosterone plays a major role in your general sense of well-being and your mental state and just your general confidence, energy levels, and motivation for life. So when you don't have the normal levels of testosterone and you dip below, all of those things turn to shit. And that means that you start getting mood swings, you're tired all the time, you have no energy or motivation to do anything, and life is literally just a pain in the ass, and you don't feel like getting out of bed and doing anything. And in a lot of ways, you feel like a big girl. Your mental state is affected, you get more emotional, you get less confident, less outgoing, more withdrawn, bit of social anxiety, you become more self-aware, and your self-esteem takes quite a bit of a knock. Then naturally you get the physical side effects of having low testosterone. That means you have a loss of appetite, your body starts to atrophy, your muscles start to shrink, your body just starts getting smaller. All the mass that you might have picked up when you were normal starts decreasing or eroding away, and you obviously, because your appetite is less, you eat less, and then you start to shrink as well. And as a man, you know that feeling like a big strong man makes you feel good. So by shrinking and losing a lot of this muscle mass that you have and strength, that starts to affect you mentally as well, which is like a snowball effect on the already negative mental capacity that you have, or the mood and overall self-esteem. So I have to go through this process to find out why I have low testosterone. And so the video today that I'm recording is just to tell you ways that I am using to help prepare for this testosterone crash that I'm going through. There are things that you can do to try and boost your natural testosterone levels as high as possible. I mean, it's not going to be great, but it's going to be better than sticking to your normal habits. And by preparing and changing your lifestyle habits to the most optimal ones that you can, you are going to reduce the negative effects of the testosterone crash. So let me discuss now the ways that I am preparing and that you can also prepare for a testosterone crash. Okay, so the main two areas that are affected by low testosterone when you go through a low testosterone crash are the mental side of things and the physical side of things. So I'm going to go through all of the side effects that you can expect to experience, and then the treatments or the things that you can do to lessen the effects of those side effects. So I've created a bit of a list here. I'm not going to remember them all out of the top of my head. This is just a bit of an informal video. So we'll start with the things that affect the mind. Okay, so number one, low testosterone is going to give you self-doubt, insecurity, and anxiety. When you have normal testosterone levels or elevated testosterone levels, you feel great. You feel normal, you feel confident, you feel motivated, you feel outgoing. All of this disappears when you have low testosterone, and so mentally you really have to prepare for that and try and do whatever you can to stay in a positive frame of mind. So the first thing that I do with this is something that I do every day anyway now, and that's meditation. 20 to 30 minutes every day in the morning. Just sit down and I meditate, and I try and clear my mind of all the chatter. Because one thing that will happen when you have low testosterone more than when you don't is that you're going to get a lot of this self-doubt, chatter, all this self-talk about insecurities, how you're not good enough, and you really have to get rid of that shit. And meditation is a good way of doing it. It doesn't get rid of it completely, but it calms you, it keeps you focused and clear, and it reduces that a lot. So that's one way you can help prepare yourself mentally. The second way is to keep positive influences around you and not negative influences. And that can be people that stress you out, people that cause you to, do your negative habits such as drinking or any other sort of party lifestyle that you have. You have to eliminate that. You've got to keep yourself healthy and focused and positive during the testosterone crash, and you're just going to have to say to your more negative influences in your life, sorry people, I'm not, you don't even have to tell them, but if you want to, you can tell them, I'm not going to see you for the next month or two. I have to, stay focused on something that I'm working on, and I'll catch up with you when this is all over. The third thing that you're going to experience is tiredness and lack of energy. This is a big one. Normally, I jump out of bed at like 6:30 in the morning. I don't need an alarm clock, and I'm on my way. When you have a low testosterone crash, you're back to low energy levels and no motivation. So you wake up and you're totally lethargic. You do not want to get out of bed. You want to sleep later. You can stay in bed an extra 2 or 3 hours if you don't mentally push yourself to get out of bed. So one thing I do when I am on a low testosterone crash is I make sure I get enough sleep and enough good quality sleep. Normally, when I'm on optimal levels, I can get away with 6 to 7.5 hours of sleep, and I still have perfect energy the next day without being tired. When I'm on a low testosterone, I have to get 8 hours. and it has to be good quality sleep. So I make sure that I'm in bed by 10 o'clock at night, and then I set the alarm clock for 6:30 the next day, and make sure that I get 8 to 8.5 hours of good quality sleep. I still feel tired when I wake up, but getting enough sleep is just enough to give me that nudge that I need to get through the tiredness in the morning and to get started with my day. So the last thing that gets affected, that can affect your mind, also physically, is when you have a low testosterone crash, you have a low sex drive. So basically, the way you can measure this is, normally if your testosterone levels are normal, you're going to wake up with a morning erection and feel horny, every morning or maybe every second morning, but often enough that you notice it. When your testosterone levels drop, you can expect this maybe once or twice a week if you're lucky. So one way that I find that you can boost your natural sex drive is to just think about women and be around women more. So this is going to be tough if you have a girlfriend, because being in a routine and having a fixed girlfriend like that, from the research that I've read, seems to indicate that can lower your testosterone slightly, especially if you're married and you've been with the same woman for many years and things are kind of in a lull. So what I try to do when I'm on a low testosterone crash, and I know my sex drive is going to be low, I make sure that I go on the dating sites often. I talk to a lot of women, and I set up lots of dates. And this kind of busyness and having this sort of exposure, to many women, seems for me to definitely elevate my testosterone levels a lot more. And so even though I'm going through a crash, I can expect a pretty average and not low sex drive than normal. So I think my sex drive is pretty normal even when I'm going through a low testosterone crash, as long as I'm exposed to lots of how would you call it, external influences. Okay, so then, all right, sorry, here's another one for physical and mind. Another way that I reduce the effects of low testosterone is by supplementing. So normally I supplement anyway, but during the low testosterone period, I make sure I do this properly. That is by drinking lots of water, taking a fish oil supplement, having zinc and magnesium supplement as well, which is shown to help, not boost, but just get your testosterone levels working optimally. Yeah, I've spoken about stress. You definitely want to reduce stress, whether it's from a girlfriend or whether it's from work or something. Me personally, now during this month crash that I'm going through, I've basically communicated to my clients that I'm not going to be working much during this time, and I make sure that I put all work stress aside. I do only what I have to and try to stay as calm as possible, and I use the extra time that I've gained by not working, and I'm putting that into focusing on the physical side and boosting my body physically wherever I can. So I guess that's a good point to move over to the physical side of things. So when you go on a testosterone crash, when you're going to notice that your body is going to start to diminish and maybe shrink. You're going to have a loss of appetite, and if you don't maintain that properly, you're really going to see a decrease in size. So you have to accommodate that. And the way I do this is by, number one, forcing myself to eat a lot. It's difficult. You have to force the food down your throat, but you got to do it. It's the only way that you're going to maintain your mass. But I also make sure that I eat strictly clean foods. So I eat strict whole grain carbs. I eat vegetables, smoothies, really, really whole clean foods. I stay away from the added sugar. I stay away from the takeaways. I stay away from the easy to prepare meals. I prepare all my meals myself. I eat things like lamb, beef, pork, chicken, turkey, and nice, good, quality meats, eggs. I also eat lots of fats in terms of avocados, nuts, butter, olive oil, coconut milk. I make sure I have a nice balance between proteins and healthy fats, and then also healthy carbs, especially on workout days. And on that note, when I'm on a low testosterone crash, I work out more. I pretty much work out 6 to 7 times a week. And that consists of 3 heavy days, which will contain squats, bench press, deadlifts, overhead press, and the overhead press. And that'll be 3 days a week at least. And I also squat 3 times a week. High bar squat one day, low bar squat the other day, very heavy, and front squat the other day. Then in between that, what I'm doing is either a cardio day with high intensity cardio just for about 45 minutes, and stretching and ab work, as well as jiu-jitsu, which is something I've just started. So that's basically the exercise regime that I follow during a low testosterone crash. I work out more, but because I know that I have to drop the weight slightly because I just physically cannot handle as much as when my testosterone levels are normal. Then what I also do is, when I have time, is I do Pilates stretches in the morning just to free up the body and stretch it out. Especially if you're sitting a lot and working, you need to do that. And if there's a bit more time, then I'll also do some yoga, sometimes with a meditation, just to also stretch out the body, be flexible, to relax and to breathe properly. Okay, then the most important part, physically, what I do during a testosterone crash is I avoid alcohol. Me personally, I can go a week or 2 without drinking, but then when I do drink, I tend to binge drink, which is probably one of the contributors to my low testosterone from the beginning, but it is something I'm working on. But when I'm going through a low testosterone crash, I don't drink at all, with one exception, and that is if I'm going on dates. So if I'm going on dates, then I will have 1 or 2 drinks, and I make sure that when I do have those drinks, that it's just vodka, which is like really the cleanest kind of alcohol that you can have, and avoid beer. Beer is known to have some sort of estrogen in it, or estrogenic effect that you don't want affecting you when your testosterone levels are already low. So if I'm not going on a date, I don't get to drink alcohol at any point, which is kind of a nice motivator as well, to get out there and meet new girls and go on the dates and boost your testosterone levels by exposing yourself to femininity and girls, and then you get to have a drink or 2. Yeah, so I think that's basically it. And then like one point that I saw is just do whatever you can to get your energy levels high. So obviously exercising will do that, except just don't overtrain. Eating the right types of foods and supplements and things like nice green leafy smoothies. These healthy foods are going to do everything that you need to give and boost your natural energy levels to the maximum levels that you can with low testosterone, and that should be enough to get you through the crash, to keep you mentally sane and not wanting to lie in bed all day miserable and anxious, and also physically enough energy to get you to the gym, to push you through those workouts as much as you don't want to, but you will have the mindset and the drive, barely, but enough to get through your days and to get through the testosterone crash and to make it to your next injection or treatment, wherever that might be. So I think that's the end of this video. It's really gotten a lot longer than I was expecting it to, so I'm going to cut it now. But you can expect more videos, regarding testosterone treatment, what it is, should you be taking it or not, how it can affect you, what to do when you don't get it. All of these types of topics I'm going to discuss in my personal blog and channel here on YouTube. So I hope you found this information helpful. Thank you for watching. If you'd like to get more videos like this in future, just click the subscribe button below. And yeah, I hope this helps you, and let's go on this journey together and beat the low testosterone, get back to normal levels, and be healthy and happy again. See you next time. Bye.